We caught voices that are no longer here. Providers pay more attention to the people, not patients, the people.
We are not enemies. We are not in competition.
We have an infrastructure here that doesn't support the people, right? It is a numbers game. We know that. It is a financial game. All this is politics, but politics in so many different spaces, right?
Yeah.
This is the first time that we have a team that looks like literally every population that we serve.
As I'm trying to help the community, there's someone that's going to notice and someone that's going to benefit from my hard work.
Welcome to another episode of Keep On Loving Podcast. I am your favorite Rose, Mystkue Woods, and your host. And today I have some lovely team members of mine from the illustrious 8th floor of the DHH office. So Lyric, welcome. Antonio or Toni, welcome. And Andrea, welcome. How are y'all doing?
Happy to be here.
Wonderful.
We are well.
Doing well.
Awesome. So tell me, what do you all do on the floor that don't nobody go to? They're really private over there.
Authorized access only. Yeah, we're housed in the surveillance unit of the Division of HIV Health. We work on a project called the National HIV Behavioral Surveillance Project. I can tell you a little bit about it.
Yeah, of course.
It's a CDC-funded surveillance project to investigate different vulnerable populations throughout the country that are at increased risk of contracting HIV, to learn more about different sexual behaviors, demographic information, drug and alcohol use behaviors. And then we also offer incentivized rapid HIV testing and sometimes other STI testing on site to kind of see how these behaviors are tracking with actual test results and health outcomes in the city of Philadelphia.
Awesome. Is this the same organization that works with the surveillance report for youth that they come out with?
That's a great question. I know we put out a surveillance report in terms of like DHH on the 8th floor. They come out with an annual surveillance report that compiles data from a few different projects, including NHBS. Okay. But a report for youth specifically, I'm not totally familiar.
That's not a part of what we're doing. We do specific at-risk groups.
Okay, awesome. And who are those at-risk groups?
Well, currently, we're about to start a cycle that focuses on cis-het people that are most at risk for HIV, but we actually have 4 primary groups that we focus on. We have the het population. We just finished last year PWID, which stands for People Who Inject Drugs Cycle. And then before that, we had men who sleep with men and trans folk that we've done research with. So.
All right, and you said het was the first one for hepatitis, correct?
No, het. Sorry,
het.
as in
Heterosexual.
Clarification. We've done hepatitis testing in the past, but yeah.
Okay.
Yes.
Got you. So cis het, PWID, men who have sex with men, and trans folks.
Yes.
And
Awesome.
cis-het is like the same group.
Gotcha.
So yeah.
Yes.
Sorry.
Awesome. No, you're fine. So just clarifying for our lovely audience. Thank you.
Yeah.
Okay, so before we get into all of the things, you just gave me a bunch of different groups. What I want to know from each of you is, do you feel like there are a group of people that may be missing or not included in those subgroups that you just gave me?
That's a great question. And I think Toni and Andrea have some thoughts on this as well. I guess I'll say briefly that the different cycles are specifically like exclusive of the other groups that we mentioned. So for example, this year's has heterosexual men and women who have not injected drugs and men who do not sleep with men. But we've in our sort of planning for the project, we've learned, some people are not as upfront about their sexual behavior and sexual history, and those people may not get caught or captured in the MSM cycle, but then also maybe don't get captured in the het cycle because if they do tell us the truth, they don't qualify.
Yeah.
Right. So I think there's a lot of intersections that we try to capture in the work we do on the ground. But I'm curious what you guys think.
I mean, you said it pretty well. I will add to that. It is. It's often. I've not experienced a cycle where we haven't missed, in my opinion, a group of people. You know, when we think about folks who are in the spectrum of LGBTQ plus that maybe aren't identified as women or men or trans, the non-binary gender fluid folks often kind of fall somewhere in the middle. And are hard to categorize for which category vulnerable population they fit best in. And we often miss people. So, yeah.
Yeah.
Well, for myself, I'm a little disappointed because for the trans cycle, as you know, with what's going on in government, we may not get the chance to capture those voices again. But the satisfaction that I have in us being able to do it the first time and the only time, we caught voices that are no longer here. One of the young women, one of the young trans women that we actually interviewed, not days after we interviewed her, she was found in a hotel room dead. There was another girl that came onto our truck and she did the interview days. Wow. And she got jumped in the neighborhood by some straight teens because she was trans, and she died from her injuries. So just the fact that we were able to capture some voices that would not be able to speak now, but we got to know their concerns, their worries, their wants, their desires. So I'm disappointed, but I'm not, how can I say it, totally disappointed because we did get something positive out of it. And they may not be here physically, but they had the chance to say what they had to say before they left here.
And they're leaving a legacy, and that's what's the most important, right? We can always build off a legacy.
Yes.
All right. Well, thank you for that. So I know that was a little off script, but I'm always curious to know what you all, as you do the work and y'all outside for real. Y'all not like me in the office. Well, that's not true because I get to be outside a little bit too as the community engagement coordinator. But a lot of us do the work, within the DHH office, and we don't get to go out and really talk to people. So I think it's important to be able to see where you all are at and how you feel about it.
Right.
Okay. And so a little bit about Keep On Loving. So Keep On Loving, we have been through some cycles. So we are on season 6 of America's Next. I'm kidding. So we've had some different nuances of where we want to take the podcast. But now where we are is that we are going to be really talking to providers and getting, insight from individuals who work with providers. And so this conversation today is going to be focused around NHBS and how providers can support, but also how the work feeds the information and the needs of the clients and the providers. So with that being said, what do you all think are the benefits that providers need to know when they're seeking out potential candidates for the study? And what are some things that maybe they haven't yet thought of?
Yeah, that's a great question. I think for just to add a little context, Andrea and Toni have been on the project for a couple years now. This is Toni's 3rd cycle, Andrea's 7th or 8th, I believe. Umpteenth. This is my first. I just joined in March, so but I can say on a personal level, like the reason I left my previous role to come here was because of the direct impact that the data we collect has on driving policy and programming locally in Philadelphia, but then also at the national level, because again, this is a CDC-funded study. There are 20 plus sites across the country. The data all gets aggregated at the end of the day. So I think that is the impact that providers hopefully are aware of. If they're not, once they listen to this podcast, they will be, that this information that they help us collect will sort of directly impact their patient populations, especially in these vulnerable communities.
Yes. Yeah. I think for myself, I'm glad of one thing. A lot of times when you do something repetitive, a doctor sees patients repetitively every day, all day. So after a while, your patients just become patients, right? It becomes an automatic thing. Next. But when we do these particular studies of specific portions of the community, it makes a provider have to pay attention in order to see who qualifies, who doesn't. But at the same time, in that close supervision, you catch a lot of things that you would not have caught otherwise. So that's what I'm interested in, when it makes the providers pay more attention to the people, not patients, the people. And then that way we know that they're getting more services and getting served the way that they deserve to be.
I think the message that I want to specifically say is we are not enemies. We are not in competition.
Yes.
So many times we go to speak to providers about like how their patients or, people could benefit from our project and how they, could pass the information along. And one of the first and often things that they say is, well, how are you going to handle our patients? What are you going to do if you do get a positive? Where are you going to send them? How are you linking them? Of course, the important protective questions, but just to know that we work in tandem with you.
Right.
We're not trying to work against the grain. There's no competitive edge to the work that we do, much like I call her Mother. Much like Mother said, we're here to capture voices to add to as a resource. So trusting us and building that relationship because as we know, the health department historically may not have always, had the best relationships with provider and community, but that's what we're here to do. So.
Yeah. But I think that something that you speak to is the historical component, right? Yeah. And so I would argue that it's not just the health system, but it is an entire institutionalized system, right? That we have an infrastructure here that doesn't support the people, right? It is a numbers game. We know that. It is a financial game. And I don't believe that every provider is out here, right? We have some outliers who, they do some things. And we're like, now how did you? But anyway.
Took an oath.
Right. And so with that being said, I think that it's important to uplift those who have become bogged down because, you know, the need has gone up exponentially, but there's not enough support and there's not enough agency to be able to get the outreach that they need done and or also support. And so where you all come in at is this great, space of like, hey, let's be here to motivate and navigate this thing together. But it also comes with I'm not teetering the line, right? Because I have all of these things. Again, all of this is politics, but politics in so many different spaces, right? Yes. And it's interesting how one word can have multiple different meanings.
Okay.
Yes.
Right?
And different responses, too.
Yes, because, depending on what type of room you're in, you might get a whole different response, right? Absolutely. So, yes. So when we think about that, how do you all build trust within the community? Because I do think that it's one thing to build trust with the people that you will be working with, but also building trust with the providers. Because let's just say hypothetically, you have a provider who comes on board and they a little shady boots, right?
Shady down.
All the way.
Been there, done that.
And so what does that look like, right? Because now you have to not only kind of go back, but you have to protect the study. You also have to protect you all and your, thoughts and emotions and feelings and your connectivity. But now you also have to go back and support the clients and the patients and the people. Right. So what does that look like?
It is a very complex. Sorry.
No. Go ahead.
It's a very complex program, and we have a lot of relationships with providers, community organizations, community members who we consider like, if we were just talking about different words mean different things, but we call them key informants, right? Which can land differently for people.
That sounds like an FBI.
I know, right. But
the verdict is still out.
But I think that it's sort of inherent in the collaborative nature of the project that we will have challenges with providers, clients, internally even, or with the health department, with the CDC. But I think that's what is really impactful about the work when it goes well is we've like worked through all of these challenges to produce a product in the field that is like making a difference.
Indeed.
Yes.
Yeah.
I was just going to add to that. That was kind of almost heading towards the direction I was going. Two things that come up for me. One, when you do patient-centered care, there's no way that you could ever be in conflict with a provider or the patient because,
in theory,
in theory, right? I'm going to use a particular theory, Maslow. Maslow's hierarchy of needs, simply put, tells us what is the centered most thing that this patient needs, and it's physiological needs first, and then you build up the triangle. I feel like being patient-centered in your care will always bring a synergy to if like you said, they're not shady down. If the provider's goal is to be patient-centered, that will always bring back focus. But then the second thing that I want to highlight is I think representation, diversity, equity, and inclusivity. I'm gonna say it.
We're saying that here on Keep On Loving. I'm just saying, we're saying it.
Fight
it's
me.
not banned.
No, don't. But seriously, having a diverse group of workers, like starting from the office, being front facing as a job, what do we look like? How are we showing up to even meet the provider and or meet the client? And oftentimes it's folks that don't look like the communities that you're serving. Thankfully, we have a competent, culturally competent, leader who is aware of that. And this is just a candid thing that we were just talking about a couple weeks ago. This is the first time that we have a team that looks like literally every population that we serve.
That's beautiful.
So those are things that pop up in my mind when it comes to building trust. Sorry.
For me, I like the formative assessment that we do and the work that we get on the ground and start doing before we go out in the field. It builds relationships with providers because we introduce ourselves to them so that they see up front what we have to offer. Then we can take their suggestions and add to what we have to make something whole.
Yeah.
And give it to the participants in a whole pie, not pieces of a pie. And we've gotten that information by all of the information we got before. And it keeps on going like a chain and keeps it moving. And that way we can keep serving and keep serving because of the diversity. Because when a participant walks in the door and at that moment they see someone like them sitting across the table from them, that opens them up, right?
Yeah.
And then for a provider to see the same thing before they recommend a participant or a patient, they're more willing to buy into NHBS, and they can assure their patient or their participant, hey, you're safe here. These people will take very good care of you. Go on over there and get that little coupon. Go ahead and get that Visa card.
And if I may just add sort of a closing thought, Andrea just mentioned this sort of formative assessment, the sort of planning phase that we're in right now before we get out into the field. Like by design, it is very collaborative, and we're trying to build these relationships with providers. We'll be actually, some of our data collection sites are in clinics, and other sites will be in like an RV that we rent, sort of a mobile unit. But having trained and competent and talented staff who can kind of bring in these aspects of inclusivity and diversity and equity in just sort of the day-to-day makes a huge impact. Like a specific example comes to mind. A couple weeks ago, we were just, Toni and Andrea were calling through some of the providers that we have on like a resource list that we hand out to participants after they complete the survey. And just sort of verifying this phone number is still correct. Do you still offer these services that we are claiming you offer on this resource guide? And Toni connected with somebody at a clinic in North Philly, who I had never heard of. I don't think any of us had really ever interacted with. Our principal investigator wasn't really familiar with, and they were really interested in the project. And Toni was able to like make that connection, get an email address, and now we're working on potentially like doing some outreach with them in their neighborhood, and maybe even conducting interviews in their clinic on Tuesdays. So like, those little things make a huge difference for the next 4 or 5 months that we're going to be in the field.
Okay, Toni, I see you.
Little old me.
I see you.
No, it's a collaborative effort. I'm learning from both, so.
Awesome. Hey, if you're enjoying this episode and you are a Philadelphia resident and you need resources about your sexual and reproductive health, visit www.phillykeeponloving.com. When we think about the information that you are collecting, I can imagine that it is super sensitive, right? And so people hold things close to the chest. And so because
Lock and key.
yes,
Okay.
right. And so with that being said, we talk about this collaborative space that we are creating. So how do you all ensure that the information that you are getting, goes where it needs to go and doesn't end up in somebody's random data breach somewhere? No. But in all seriousness, like making sure that individuals know that the information that they share with you all is coveted and that it won't be used to place harm.
Well, confidentiality is a huge component of this project, and it's one that sometimes it's so like this isn't technically research, it's surveillance, but a lot of similarities between the two sort of approaches. And it's something that is so inherent in surveillance when it comes to HIV that I kind of forget to mention it sometimes, but especially with providers, it does a lot. And with community members, it does a lot when you bring up like, hey, this whole thing's anonymous. We don't want to know your name. We don't need any identifying or personal information from you. We just need you to answer these questions truthfully. And we have a staff that creates a welcoming space for people to feel comfortable and feel safe to provide honest answers. Obviously, there's like the maybe more boring like data security aspects of it as well. But that anonymity piece is, I think, first and foremost in making sure that the data we collect can't be traced back to any one individual. You know.
Yeah.
I mean, and the only other thing I can think of to add to that is full autonomy. Sorry, I still getting my medical terminology. I think that we all have our own experiences that have allowed us to understand what it means to respect each other's, personal space. And educating people that they are in control of this entire process.
Yeah.
From beginning to end.
Listen, this is your story. This is, like Mama said, this is your voice. This is your body. All of these things are you're the captain of. And we are here just to assist that all of these things are treated well, respected, and, represented properly. And so I think that makes a big difference as well. Once they get in that truck and they're like, okay, nobody's trying to out to get me, harm me or hurt
cameras
me.
in here,
No cameras, like the ops, the YNs with the ops, it's a whole thing.
No, but I think that it's interesting that we have this kind of parallel going, right? And so in the world is a really scary, it's always been scary, but these days it's like every day it's something new, right? It's
Exactly.
like, oh, here we go.
Exactly.
What is going to happen in the jungle today, right?
Yes.
And so you have that, and then you have this beautiful, space that you all are creating right next to it and aligning in a completely different way. And so it's what they say, the opposites attract. And so I'm just listening, and I'm like, well, I would be compelled to do it, if it's something that I fit the niche for, right? So with that, I want to talk a little bit about where the information goes. So once you all have compiled all the data and we know that it's safe and all of that, how does it inform, the work of the providers going? How does it kind of do a full circle and go back to the people?
Yeah. Yeah, so this is, as primarily like field staff, we aren't directly involved with a lot of the analysis that happens on the back end, but the CDC has folks who are sort of throughout the process, like monitoring data quality and things of that nature. Our principal investigator is an epidemiologist. So like there are trained folks who run the numbers, right, and put together the annual report I mentioned earlier, and I believe that gets disseminated pretty widely to the public and to providers. But I think really, the data drives, our medical director is constantly like advocating, on a budgetary level, like where do we need to push this money? What zip codes are facing, the most, are most vulnerable, I guess. And where are the gaps in education and access and affordability and insurance coverage? Like how do we educate and inform and provide this access to people? So it kind of happens maybe above where we're at, but that's at least my understanding of where the numbers go.
Yeah, no, and I think I can give you an example of how I understand the breakdown of how community kind of gets back what we have extracted. I keep wanting to knock your mic over. I don't want you to be successful. I'm sorry. I hosted a symposium about 6 months ago for continuing education on HIV. And a lot of the data that they use to educate a room full of providers that directly sit in the Philadelphia, Delaware County kind of area, straight up came from the research that we have extracted out of these populations. And so what does that look like? That means the people who are those providers, the shady down girls, are now having on their ears real numbers, real research, real, barriers, as you mentioned, that actually tie into their people, patients' everyday lives. So, yeah.
Awesome.
For me, and this is something that I wanted to explain to you, we do respondent-driven sampling, which means as we give one seed some coupons, we bring them in, we interview them, and we do all of this. That starts a chain, almost like a flower that has a bulb and has one leaf, two leaves, and it keeps growing that way. But it shows what's needed in different portions of the neighborhood because of the different portions of people that you are interviewing.
Yeah.
And that's because each one reaches one, and that one reaches another. And before you know it, the vine is growing.
Come on, Vine. Listen, you talking my language.
That's why I call her mother.
Come on.
She
That
took
was
everything that we
beautiful.
said and made it beautiful. That's what mothers do.
Thank you so much for that. No, I think that is amazing. All right. So, pop quiz. Just kidding. Tell me what is your most coveted, the aha moment, or just a really amazing moment that you've had while working on this study and that you're most proud of?
Y'all should go first since I'm new.
Well, I'll
Forgive me, but I need to show you something.
All right.
Go ahead, talk.
I was going to say I'll start because I'm sure she has way more experiences to sift through. For me, one of the things that I'm glad I didn't go there. I'm glad I didn't go there because I would have taken yours. Okay, I'll shift. One of the things that I think, two things that come to my mind. Once during the MSM cycle, unbeknownst to me, I saved someone's life. A person completely scared the crap out of us running on the truck and interrupted the technical flow of research. But something in my spirit in that moment was don't interject, listen. I did actively listen, and I realized all they needed was Narcan, and they were a little intoxicated. It was late night, XYZ. I didn't question, right, because we were conducting research. 15 minutes later, I went around the corner, and there was a whole scene, and I was like, what happened? And they were like, you literally just missed the ambulance taking somebody to the hospital, but the only reason why they're alive is because they got Narcan from somewhere. And I was like, wait, the person that just came on the truck literally just came and got, snatched it out of my hand, and I didn't even get a chance. I was trying to explain how to use it. I was more so concerned about doing my job, but they saved someone's life in that moment, and that, to this day, still sticks with me. One, stay ready so you ain't got to get ready. So,
Hey now.
Have your stuff on you at all times, even if that's just, Narcan or whatever, but having the materials, the resources that people need in the moments that they actually need them. And then seeing people as people and not as a threat or as, a disturbance or a break. We were on that training a couple weeks ago with the health department that Evan did about, just the sensitivity to people. Someone showing up in their full self, even in frustration or desperation, is a form of resistance, is a form of, fighting for self and what people deserve, which is basic human rights. Yeah. And so that has impacted how I move forward in the work that we do.
All right.
I love the fact that we help people. And I love the fact that we, as we're collecting from them, we're also giving. So it's, you scratch my back, I scratch yours, and we keep life going for each other. We had a participant come on our truck, and she was so sweet. And she did everything, and we gave her little swag bag and her Visa cards. But she liked us so much. She kept saying, I got something for you. I got something for you. And we were, okay, that's nice, all right.
I don't know if I want that, but...
Well, a few minutes later, she comes back to me and Toni, and she hands us this lotion
Oh, wow.
from Pride. And she says, I just wanted you to have it.
Have something.
Awesome.
And mind you, it's a small container of lotion. But how do I know it didn't take her to move mountains just to acquire this little
Right.
small thing of lotion? And she wanted to share something she had with us. We
Yeah.
call ourselves trying to give. But she wanted to come back and give something to us.
Yeah.
It smells so good.
It
I don't want to
does.
use it because I don't want it to end.
Right.
But I keep this bottle in my purse so that whenever I see it, I think of her and I smile. And I can really remember her face
Yeah.
in my mind when her handing this to me. So that's something that gives me the drive to keep doing what I'm doing, because as I'm trying to help the community, there's someone that's going to notice and someone that's going to benefit from my hard work.
And they already are. I'm sure of it. You
Yeah.
learned?
Well, so it's hard to follow those two fantastic and powerful stories. I think because we've had some really great interviews with community members and different professional organizations and providers that have really like energized me to get out into the field. We're not quite out in the field yet, but we expect to be later this month. But I think the thing that I'm just really excited. I don't know if I can say there's anything I'm proud of yet because we haven't seen the product yet. But I'm just really excited given the stories that I hear on a regular basis. I mean, those are just two, right, of dozens of a lot of experience doing this work. And I'm new to the work. So it's really, I think, motivating me to like make sure we get out and we're prepared. And the folks that we just hired have some stories too that they've provided to us. And I think they've got a lot of experience and talent to share with people. So it's really, it's more of an excitement, I think, for me and motivation that I've gained from the team and from the work thus far.
And let me just add this in here because my boss does not like to talk about himself. Though he is new, the impact that he has made already to the team has been far more than we could ever ask for.
In just a few months.
Yeah,
That's great.
we have a very culturally competent staff because he was culturally competent enough to hire, to assess, to be inclusive in all parts of what make a good team. So
I love that.
you'll have
Come
your
on.
stories, but
Yeah.
The stories will come, I'm sure. We'll have
You
to do
are
a
contributing
recap.
still.
Yeah, of
pod
course,
at
of
the end the
course.
year, yeah.
Absolutely. And you sowing the seeds, right? That's how we build growth. It's a beautiful thing.
That's right.
Yes. All the blossoms, all the gardens. We love it. We love it. All right. So tell us where and how can providers or even potential people, clients, right, come and be a part of NHBS in the study and get to interact with each and every one of you.
So that is one of the unique things about this project that Andrea spoke a little bit about earlier with this respondent-driven sampling piece. We are currently in search of what we call seed participants who kind of meet some of the criteria we've mentioned for this cycle, cisgender, heterosexual, meeting certain income and education requirements, things like that. These are conversations we can have, offline if there are providers who have people who come to mind that, everything we do is incentivized. If there's somebody that comes to mind who you think would be a good candidate, who's well connected, feel free to reach out to me at, I don't know if I should read my email right now.
Sure.
lyric.kleber@phila.gov. But, I think getting in touch with us is the best way, and then we can kind of coordinate from there. Because, again, as we've kind of talked about, this is a lot of sensitive information, and we want to give it the proper amount of time and care to identify people who are a good fit.
Absolutely. Do y'all want to add anything?
He nailed it.
I have to just say
Nailed
this much. He underplays himself sometimes, coming in but that's a part of his humbleness, and that's a part that makes the team great. No one is a bigger eye than the other. So I like the fact that he has come in. I like the fact that we're able to get our staff prepared. I like the fact, because all of this preparation, when we actually get before the public, it shows us first organized which gives us a buy-in from them.
Yeah.
And then when we carry through with the organization and the pluses and what we have to offer the community, it just makes the job that much more pleasant and fulfilling.
Yeah.
Because to know that I'm helping someone who might not have had a meal that day, who might not have even had someone see them that day, as in, people, you see someone who needs, you walk right past them because you've gotten so used to walking past a homeless person or a drug person, and you just, whatever. But for that person to realize that somebody's really looking at them in their face and dealing with them on their own terms, that lets me know that I'm doing something right, because they come back and they bring others. You wouldn't bring someone to someone else that you don't trust.
That's true. That's true. Absolutely. Well, this has been amazing. Thank y'all so much.
Thank you for having us.
Very welcome.
I appreciate it. I have learned a whole bunch, stuff that I didn't know, stuff that I was like, I feel like this is what that is, but I'm not exactly sure. So I appreciate, you all diving in and really, watering me today with knowledge, and I appreciate it. And to the audience, I hope that you are able to take something from what our guests have said today. And with that said, no matter how you're loving,
just keep on loving.